All right, glad to have you back. Now, being diagnosed with hepatitis is not a death sentence, and that's what we've known, we've understood over the years. This year's theme is Test, Treat Hepatitis, and it underscores the need to scale up testing and treatment activities.
Yeah, now the World Health Organization says more than 350 million people globally remain infected with hepatitis B virus. More than 1 million people die yearly from chronic active hepatitis. The prevalence rate is high in sub-Saharan Africa, and Nigeria has one of the highest burden of hepatitis B. How can Nigeria ensure it beats this preventable, curable and treatable disease is a big question on our minds this morning.
Yes, but we have joining us from Abuja studio a representative of the World Health Organization country director, Dr. Rex Mpazanje. Thank you for joining us on the show. Good morning to you.
Good morning.
All right, good morning. First off, let us understand how dangerous hepatitis is.
Hepatitis is now one of the leading causes of death worldwide. The recent statistics are showing that hepatitis is coming to surpass TB, is coming to surpass HIV in terms of as a cause of death worldwide. While the sort of deaths due to HIV and TB are coming down, those due to hepatitis are increasing. And therefore, this is a reason why we are shining limelight on hepatitis. In general, we estimate that globally about 1.34 million people die every year due to hepatitis, and 60% of these die due to liver-related complications, mainly liver cancer. So it is quite an important cause of death, and the good news is that it is preventable, it is treatable, it is curable. Therefore, there's a whole need and sort of urgency to shine light on hepatitis and have countries start paying more attention on it.
All right, make us understand what really causes hepatitis so we can know how to prevent and all of that.
So hepatitis, the word hepatitis itself just means inflammation. Therefore, anything that causes inflammation or the swelling of the liver causes hepatitis. But in this case, the one we are shining light on is the swelling or the inflammation of the liver that is caused by 5 viruses. These viruses are labeled hepatitis A through to E. The important ones that we are shining more light on are B and C, because A and E only cause epidemics. I think you may have seen in the last year in Borno where we had an epidemic of hepatitis E, for example. But B and C cause long-term infection and chronic infection that then go on to damage the liver and cause cirrhosis or liver cancer. So the ones we are shining light on are hepatitis B and C particularly, because they are the ones responsible for the majority of the deaths that we are highlighting.
All right, are the causes and symptoms of these different types of hepatitis the same? What makes them different?
So because all of them affect the body by causing a swelling in the liver, the symptoms and signs are more or less the same, in the sense that at the initial stage, one may be seen with slight fever, abdominal pain, and also yellowness in the eyes. So that usually comes at the beginning. And the yellowness in the eyes can continue also as the liver becomes damaged in the longer term. It may go and become complicated to vomiting, but majority of the people who are carrying hepatitis B and C have no symptoms at all. And this is one of the reasons why the theme of this year is Test, Treat Hepatitis. Really is to encourage people to go for screening. as you know, in our culture, we normally don't go for screening unless maybe we are being employed or something else is on marriage or something else. But I think it is quite advisable for people to go for screening, because majority of hepatitis B and C carriers have no symptoms at all. They may have had these initial symptoms that I've mentioned, the yellowness in the eyes, the fever and some abdominal pain, but they go away for hepatitis B and C. And for a long period, you don't notice any symptom until the liver is so damaged. So it is important for people to routinely screen even when they have no symptoms.
All right. Why does sub-Saharan Africa have a high prevalence rate?
So hepatitis B and C are largely transmitted at birth. So majority of the people who are carrying hepatitis B and C now really acquired it at the time they were being born. And majority of my generation, your generation, really are carrying hepatitis because of that. It's mother to child transmitted. For sub-Saharan Africa, it's only until about 10 years ago that we started vaccinating children. So the children who are now about up to 10 years, those are being protected if they are vaccinated. As you know, there is a vaccine for hepatitis B that children get at birth. There is a penta vaccine that they get up to 1 year, about a few more doses. So this is protective. But for the generation before the vaccine, they were infected with hepatitis and they were not protected. And this is a generation that we are appealing that they should be going for screening regularly to make sure that they don't have hepatitis. In addition to transmission through childbirth, there is also active transmission through all sort of practices we do in our cultures that involve piercing the skin, like scarifications, tribal marks, and even some of the unprotected sex in some cases. So because of those that are really quite common within our living, we find ourselves in Africa that we are quite at risk, at high risk of hepatitis B in particular. For hepatitis C, those who are most at risk are the ones who inject themselves, use sterilized needles or share needles. For example, we know of injecting drug users or any other sort of group that involve injecting themselves and therefore pass on blood from one infected person to another. So hepatitis C is not as prevalent, but definitely in those areas where it involves injecting, or indeed, yes, also using scarification and using sort of razor blades that have been used elsewhere, hepatitis C is also quite common, but B is the one that is most common in our region.
Okay, so what form of treatment is available for the patient? How long does it take? And then what is the cost? Is it affordable?
So for both hepatitis B and C, there is treatment. The good news is that for hepatitis B, when you go for screening and when you are found positive, it's only about 20% of those who are positive that need treatment. Majority, almost 60 to 80%, they are found that the body has found a way of living with the virus without needing treatment, and they just needed to continue being followed up until that time that they may need treatment. So the 20% for hepatitis B that need treatment are put on lifelong treatment. For hepatitis B, there's no cure, so it is lifelong treatment. It is the same drug that is used for HIV treatment. One of the drugs, as you know, HIV uses 3 drugs. One of them is used to treat hepatitis. So it is lifelong treatment, and they are given that drug to take for life. For hepatitis C, there are now new drugs on the market that are also available here in Nigeria, which cure hepatitis C. And you only get treated on 12 to 14 weeks, and then you are cured. So for both, the drugs are not free Although we know that within the HIV and hepatitis program, for those who are HIV infected and also have hepatitis, they get it free. But for the rest of the population in the country, currently is not free. But there are efforts, I think, that may be announced tomorrow that are trying to see how to make the drugs more accessible and indeed to make sure that the services are available widely so that people can access them.
All right. Before I let you go, just in a minute now, can you tell us what WHO is doing strategically to eradicate or reduce the scourge in Nigeria or even the sub-Saharan Africa?
So WHO's focus really is to bring governments to the fore and make sure that actions are being taken at country level by all stakeholders. Governments, funders, and the civil society. One of the big things for this year, as indicated by the theme, is really to increase awareness of hepatitis among the population and to encourage this screening culture, people going for screening even when they are not sick, so that they can know their status vis-a-vis hepatitis. But also to encourage, especially for mothers, to really make sure that their children do get the vaccination that is available, and the vaccination is free of charge at birth and also the other doses by 1 year. So for WHO in Nigeria, we have really been working with the government to make sure that the policies are in place, to make sure that the materials that the doctors need for treating, the guidelines, the training materials, all those materials are in place. And we have gone further to sort of look at all the centers that can treat, encourage them to set more centers, working with the states to set their own programs, and also to come up with what will be launched tomorrow with the government, really that will encourage people to know where exactly to go for treatment of hepatitis and screening. So these are the efforts that we are doing currently to just make sure that the services are available and indeed screening becomes a norm and treatment for hepatitis B and C.
All right.
All right. Thank you very much for joining us right now. Dr. Rex Mpazanje, representative of WHO Country Director, joining us on the topic on hepatitis B and what they're doing to eradicate it. Thank you for talking to us.